So, hi Tanuja, can are you able to hear me?
Yes, sir, you are audible. Yes, sir. Good afternoon, sir. Good afternoon.
Do you want me to put on my video?
Yes, Dr. Habib, I think we should wait because the inaugural is Dr. Ankita. I think Dr. Ankita will be convening.
Sure, sure. Thank you.
All right, sir. Okay. Good afternoon, everyone. Before the event start, we will play a short documentary to give a brief tour of Maitrey College and its legacy to our wonderful audience present today. The documentary is not audible.
मैत्री कॉलेज जौनपुरी स्थित दिल्ली विश्वविद्यालय का एक प्रतिष्ठित कॉलेज, खूबसूरत आकर्षक कैंपस, न जाने कितनी सुनहरी मीठी यादें अपने अंदर।
Is it audible now?
मैत्री कॉलेज के लिए यह वर्ष बहुत ही महत्वपूर्ण है।
The role of an institution is to provide an environment that is based on strong academics, that facilitates the collaborative and creative learning for all the students. And it has been possible all because of our committed teachers, very supportive administrative and technical staff, and above all, our gifted students.
हर वर्ग और जाति, भिन्न भिन्न प्रांतों और यहाँ तक कि विदेशों से भी छात्राएं मैत्रेयी कॉलेज में एडमिशन लेती हैं। हमारा उद्देश्य इन छात्राओं को ह्यूमैनिटीज, साइंस या कॉमर्स कोर्सेज में अंडर ग्रेजुएट लेवल की केवल डिग्रीज दिलवाने तक सीमित नहीं, बल्कि उनके सशक्त व्यक्तित्व का निर्माण एवं समाज व राष्ट्र में सशक्त भूमिका निभाने के लिए उन्हें प्रेरित करना है। और हम गर्व के साथ कह सकते हैं कि मैत्रेयी समुदाय ने मैत्रेयी नाम के गौरव को वर्तमान तक कायम रखा हुआ है। मैत्रेयी वैदिक काल की और ऋषि याज्ञवल्क्य की पत्नी थी। अपने जीवन में मैत्रेयी ने सांसारिक संपत्ति की तुलना में ज्ञान के चयन को प्राथमिकता दी थी। ब्रह्मवादिनी थी। मैत्रेयी समुदाय ब्रह्मवादिनी मैत्रेयी के जीवन आदर्श को सर्वोपरि मानकर उसके साथ प्रतिष्ठित है। ज्ञान को एक प्रक्रियाओं में प्रचलित करना हमारा उद्देश्य
The college came to foundation and the movement deserves to join. I took your time to program, and I'm the president of the
college and urge you to embrace its opportunities.
1987 में मैत्रेयी कॉलेज नेताजी नगर की स्कूल बिल्डिंग से चाणक्यपुर स्थित इस आकर्षक भव्य बिल्डिंग में पूर्ण रूप से शिफ्ट हो गया। प्रिंसिपल डॉक्टर सीता श्रीवास्तव का अत्यधिक महत्वपूर्ण योगदान, जिसके लिए मैत्रेयी समुदाय सदैव उनका आभारी रहेगा। अपने कार्यकाल के दौरान उन्होंने कॉलेज की वर्तमान बिल्डिंग के हर एक विंग का विशेष रुचि लेकर निर्माण करवाया। इन्हीं बीते पलों और मीठी यादों को एक खूबसूरत अंदाज में सहेज कर बैठा है मैत्रेयी कॉलेज का ये आकर्षक परिसर।
आदर्श हमारा आओ नमन करें।
Good afternoon, everyone. I, Dr. Ankita, feels honored and privileged to welcome you on behalf of I feel honored and privileged to welcome you all on behalf of Maitre Alumni Association in the International Workshop on Public Health, Wellness and Well-being. I welcome our esteemed speaker, Dr. Habib Hassan Farooqi, Additional Professor, Indian Institute of Public Health, Delhi, and our participants who have joined us for this 2 days international workshop. There are some important announcements related to today's session. We request you all to keep your cameras off and microphones on mute. We also request you to keep your phones on the silent mode. Please type your queries in the chat box. We will be taking questions for the speaker after the session. Filling the feedback form is mandatory to get the participation certificates. We begin this auspicious day by the lamp lighting ceremony along with invoking Ma Saraswati, the goddess of knowledge. May the light of this lamp dispel the darkness of ignorance and spread the light of knowledge and peace in the minds and heart of all. We feel extremely special and honored to begin the proceedings of the day amidst the galaxy of eminent guests. Their presence undoubtedly will inspire young minds. Now I invite Dr. Richa Chilana, President of the Alumni Association, to welcome the audience and introduce the theme and background of the workshop.
Thank you, Ankita. Am I audible?
Yes, you are.
Thank you. Maitre College was established in the year 1967 with a mission to offer excellence in education to women by providing both academic as well as intellectual growth. Maitre, which is one of the most sought after colleges of University of Delhi, has an endeavor to contribute to imparting higher education to women and groom their personality so that they excel in all walks of life. Our glorious journey is reflected in our alumni who are successfully managing various prestigious portfolios. Today's workshop on public health, wellness, and well-being is an initiative of the Maitre Alumni Association to once again bring our ever-expanding Maitre family together to discuss pertinent issues and hopefully benefit from the discussion. Our Alumni Association constantly strives to keep abreast of the times we are living in by organizing webinars, virtual meets, lectures, and workshops. The session began with a webinar titled COVID-19 and 3 Ls, that is lives, livelihood, and lockdown, a virtual annual alumni meet, eSanidhya 2020, as part of which we gathered alumni from all across the world to engage with various dimensions of the pandemic. This was followed by a week-long international workshop titled Expand Your Horizon and Outlook, an initiative towards de-stressing and personality development, with the intention to help students to de-stress and continue to stay motivated in these unprecedented and uncertain times. This workshop was conducted by our alumni and in a first of its kind engagement by parents of our alumni, who are experts in counseling, nutrition, meditation, etc. The workshop also focused on soft skills and personality development to enable students to fulfill their academic and professional aspirations. The association also organized the annual alumni meet virtually this year to felicitate our distinguished alumni. If there is one thing that we have learned in the last 1 year, it is the importance of focusing on public health, personal wellness, and well-being. And it is this that brings us together again to initiate a discussion around these issues so that we are better equipped to grapple with these difficult and trying times. The pressures of education, work, and the daily business of living and getting by often makes us blinkered in our perspective and approach towards our physical and mental health and well-being. This workshop strives to sharpen our focus on these issues so that we can eat, work, and live better and more wholesome lives. I welcome you once again to this enriching workshop. Due to some urgent work, our principal, Dr. Haritama Chopra, will not be able to join us today, but she has sent her best wishes for the workshop. I now invite Dr. Ankita Sehrawat to introduce our guest. Thank you.
Thank you, Dr. Richa, for giving us a wonderful start of the event. Today we have amongst us Dr. Habib Hassan Farooqi. Dr. Farooqi is an additional professor of health economics at the Public Health Foundation of India and a visiting fellow at Institute of Health and Society, Newcastle University, UK. He obtained his medical degree from Institute of Medical Sciences, Banaras Hindu University, non-degree medicine PG from Sydney University, and was a postdoctoral fellow at the London School of Hygiene and Tropical Medicine. Before joining Public Health Foundation of India, he has worked as a surveillance medical officer at World Health Organization. One of the core areas of his research is vaccine preventable childhood diseases. He has generated the first ever country level estimates on antibiotic use and pediatric vaccine use in the private sector in India. He was also involved in the first ever state specific estimates of pneumococcal pneumonia related mortality and morbidity for India, which has helped in planning the introduction of pneumococcal conjugate vaccine. He has conducted qualitative research on immunization with PCV and rotavirus vaccine. His particular research interest is to understand the relationship and interdependency between new vaccine introduction and demand for antibiotics and consequently its impact. With more than 18 years of teaching and research experience, he is the lead faculty in the infectious disease epidemiology and pharmaceutical economics. For today's session, Dr. Farooqi will speak about role of public health in India and avenues in public health. Please feel free to post questions for Dr. Farooqi in the chat box. We will take them at the end of the session. Sir, I request you to begin with your talk. Thank you. Sir, please unmute yourself. You're not audible.
Sure.
Thank you.
Thank you very much. Thank you very much, Ankita, and thank you very much for inviting me to this webinar. Good afternoon, everyone. And it's indeed a privilege and honor to be among yours, among these bright students and alumni. So today I'll be speaking on a broader perspective on public health. I'm going to share my screen. Please let me know once you start seeing my screen. I hope you can see my screen now.
Yes, sir, it's visible.
Thank you very much. So for the sake of the bandwidth, I will stop my video for time being, but I would be looking at the chat box to address the questions. And if you wish, I can address the questions at the end of the talk. And for now, I'll talk on a brief perspective about the avenues of the public health. Please feel free to interrupt me if you have any questions or if you think that my voice is breaking. So today's talk, in this particular talk, we will specifically focus on a few broad areas of our interest. First, I would like to introduce Public Health Foundation of India to this esteemed audience. And then briefly, I'll also talk about the impact and the importance of research in the public health, and especially in this pressing
So your voice is breaking.
Okay. Let me switch to another network. Just bear with me for a second. Is it better now?
Yes, sir. Yeah.
All right. So unfortunately, we have some network issues here, but hope this network survives this 40 minutes, 1 hour long session. So today we'll try to cover upon three broad areas. One is I'll try to introduce Public Health Foundation of India to you, who we are and what we do. The second thing is I'll try to introduce how biomedical and the clinical research has helped us to address the pressing demands of the COVID pandemic. And the third thing is I'll try to give you a brief perspective on what are the different kind of job opportunities available to the students and the alumni of biomedical sciences and other areas who wish to get a broader perspective of the public health. And then in the end, we will try to discuss our few of the questions or concerns if you have any. So first of all, I would just like to introduce Public Health Foundation of India. Well, Public Health Foundation of India was actually launched by the then Prime Minister Manmohan Singh in 2006, and it was actually developed through a multi-stakeholder consultation. And Public Health Foundation is basically a foundation. It's a think tank organization which is registered as a society, and the board is comprised of several eminent personalities and members from both the government of India as well as other foundations and the industry. And the idea was to strengthen the public health system in the India by building the public health institutional capacity. And for over 15 years now, we have been working together as a public-private partnership with the industry and industrial leaders, as well as with academia, especially the people who work in the area of the public health, both globally as well as in the country, and also with several civil society organizations, because we have a very strong impetus and focus on the implementation part of the public health initiatives. And last but not the least, we work very closely with the governments, both the union government as well as the state governments. And a lot of our faculty and the research team is on several government bodies and are member of several advisory committees, both globally as well as for the Indian government. So from the perspective of public health, the overall goal of Public Health Foundation of India is threefold. One is to promote health, two is to prevent disease, and three is to set benchmarks in the public health education. And to achieve these goals, we work across four specific pillars of activities. One of them is certainly academic programs, and we have a huge portfolio of both on-campus programs as well as e-learning programs. The second area is we do a lot of professional training, not only for medical graduates and medical fraternity, but also in other areas of public health. Three is we are primarily a research-based organization, so we do a lot of research, both the fundamental research as well as translational research and implementation research and policy research. And all these three areas of research we'll briefly touch upon in the next few slides. The fourth area of our work is health systems innovation, where we try to understand and implement new technologies to facilitate public health capacity in the country. And in terms of the thematic areas of our focus, we primarily work on 12 thematic areas, so to say. And the core of them includes maternal and child health, social determinants of health, nutrition, communicable diseases, non-communicable diseases, health systems policy, environmental and air pollution, and mental health. And a lot of our programs are recognized by Department of Scientific and Industrial Research for R&D activities. And in terms of the first pillar that I mentioned, that we do have a huge portfolio of academic programs. As I said, we do both academic programs on campus as well as on e-learning platforms. So we offer programs from public health diplomas to the Masters in Public Health and MSc Clinical Research, but also the PhD programs. And in terms of our geographical presence, Public Health Foundation of India has several Indian institutes of public health spread across the country. And the flagship institute is based in Delhi, where the headquarters of the Public Health Foundation is also located. But we have presence across Gujarat, where we have Indian Institute of Public Health in Gandhinagar. We have presence in South, in Hyderabad, where we have Indian Institute of Public Health, Hyderabad. We have a campus in Bangalore. We have another institute, Indian Institute of Public Health in Bhubaneswar, and another one in Shillong. And across all these programs, we run several programs, right from public health diplomas to certificate courses to MSc Clinical Research, MSc Bioinformatics, and Masters in Public Health. And let's now come to the core thematic area of today's talk, which is about importance of research in the public health. And you, as graduates from different walks of the field, including botany, zoology, mathematics, and other social sciences, you probably have come across a wide number of academic researchers and fraternity whose books you refer on daily basis for your learning purposes, and also you probably have gone and learned from their research articles. So the same happens in the public health also. And public health is largely a research-driven field. And if I look into the definition of the World Health Organization, public health is primarily a discipline and an organized measure, whether it is public or private, to prevent the disease in the community, to promote health in the community, and to prolong the life among the population as a whole. So the threefold purpose of strengthening public health is to strengthen disease preventive measures, to promote health, and to prolong life. So if you see from the core functions of the public health, you would really understand that the core area of work for public health is assessment in terms of understanding what is the health need of the population. For example, if you have really visited rural areas or some of the urban slums, you probably have identified that these particular populations are vulnerable populations and are actually exposed to different kind of risk factors. And you probably have thought to what are the important needs of these populations. So one starting point for the public health intervention or public health activity would be the assessment of the need of the population. The second one is also about the policy development, and all this policy development can be thought from the perspective of how we can improve the national policies, whether it is policy related to the nutrition or policy related to the vaccination. How do we develop these policies that we are able to address the needs of these communities, not only the ones who are most vulnerable, but also the ones who are unable to have access to care, and how do we reach those last mile populations? And the third one is about assurance. And assurance means providing entitlements or providing measures to address the needs of the communities which are more vulnerable. For example, you probably have heard about the national health assurance or some kind of assurance with regards to the livelihood or assurance with regards to equal rights for the gender. So the core function of public health actually starts from the need of the population, and then they go on to actually develop appropriate policies and assurance mechanisms so as to address those needs. So for example, in the assessment, you can think of COVID as an example. And COVID, which is spreads through what is called as coronavirus, is a novel pathogen. Nobody has ever heard about it before the coronavirus epidemic started. Though there was an outbreak of SARS-CoV-1, which is SARS coronavirus 1, uh, almost a decade back in 2003 in China. But for the rest of the world, this was a new pandemic which started in January 2019. So if we think from the need assessment, we can think that this is a respiratory pathogen which spreads through droplets and also spreads through airborne transmission. So what are the important health hazards? So we arrive to a understanding that important health hazards are crowding. Important health hazards for spread of this disease could be closed spaces, it could be lack of ventilation, it could be contact with the infected individuals. And once you start analyzing these factors, you can think about the policies that you need to implement to stop the spread of the disease even before the vaccine was available, even before we really had an understanding about how to treat the patients who get this particular disease. So assessment actually provides us a broader understanding about an infectious disease. We can use the same framework to think about non-communicable diseases. For example, obesity. We can think about whether in urban areas of Delhi or in the rich population of the Delhi, which you probably know are having higher per capita incomes and are engaged in a lifestyle which is more sedentary than other populations and are prone to obesity. So you can think of assessment and the implications of obesity on those population. And then you can think about the policy that needs to be implemented to actually prevent the epidemic of the obesity. So that's the framework of assessment. The second thing we discussed about was about the policy development. We said once we are able to identify the core risk factors, we can think of developing policies or the programs and work with the communities to help understand their risks for a specific illness, their risks for a specific health event, and have also worked with the government to develop the policies which enable those vulnerable communities to come out from those risk factors. So for example, again, if we take an example of COVID pandemic, we clearly recognize that one of the major risk factor of a spread of this disease is super spreading event. It could be a simple household marriage function, or it could be a birthday party, or it could be a large gathering. It could be a professional gathering or a political gathering. And now once we understand these nuances with regards to the disease spread, we can work with the government as well as with the population to help them understand that these are the risk factors, and we then devise these policies with regards to the social distancing or appropriate COVID behavior, such as using face masks, such as using sanitizers, such as using proper ventilation, and such as using social distancing to prevent the spread of the disease. So policy development is an art actually to work both with the policymakers as well as with the people on which these policies will have an impact. So in the policy development, we work together with the community to understand their needs, and with the policymakers for the implementation of the policies. We prioritize the needs of the communities, which could be need related to the livelihood or which could be need related to the health, and then plan and develop those policies which are beneficial for all the stakeholders. And the third dimension that I would touch upon is about assurance. And assurance is a pretty broad concept. and it's all about managing societal resources. So when I say societal resources, I mean to say that as a society, we share several resources. Air and water is just one of them. Other than that, we share resources such as financial resources. For example, when we buy any product, there is a certain proportion of tax which is levied on it, which goes to the government. So is our income tax, so is the GST. So those resources can be used for improving your health. Those resources can be used for improving infrastructure. Those resources can be used for providing vaccines, and those resources can be used for providing and creating jobs. So assurance actually involves management of all these resources, and those resources for betterment of the community or betterment of the society. And once those decisions are taken at the parliamentary level or at the state level, then several programs are designed. For example, you have heard about Ayushman Bharat, which is a program which provides assurance to the people living below poverty line for as a part of insurance package to take care of their illness in the need. So that's an assurance program. So as a part of assurance, you manage these resources, both the financial resources and other societal resources. You develop these assurances program, such as I mentioned about Ayushman Bharat. Another program you can think of is policies that provides Sarv Shiksha Abhiyan, which provides education to primary to the children which are enrolled in the primary schools, such as national nutrition programs, which ensures uh, nutritional supplement to the children who are in the school. And then you devise and develop these programs and implement in specific sectors. But at the same time, you also want that these resources should be used appropriately. So you need to evaluate those programs. And after evaluations, you do your course correction. So as a part of assurance, you can think of understanding that several national health programs in different sectors, be it as education sector or a health sector, are planned, implemented, and then evaluated so as to provide the best bang for the buck, which we have used from our societal resources. So now you think from a broader perspective, you would realize that as a part of the public health, you are engaged in activities at all levels. You are engaged in activities related to the assessment, you are engaged in activities related to the policy development, and you are also engaged in activities related to management of the resources. So for example, if you now take a perspective of the COVID pandemic, you can think of a broader public health response to the COVID pandemics, in which you probably have heard about uh, policies such as appropriate COVID behavior with regards to using of masks, with regards to use of certain precautions such as social distancing, which also involves now use of vaccines to prevent the disease. And you probably have heard about use of lockdowns as a strategy to prevent social crowding and to prevent the spread of the disease. So there are different people who are working in different areas. If you think from lockdown perspective, you probably have seen a lot of people who help ensure lockdowns both at the smaller level and the larger levels are from police department, are from municipal departments, and also from local resident welfare association. But those who are involved in treating patients and vaccinating individuals are from the health department. They are the ones such as the doctors and the nurses who are engaged in the vaccination related activities, as other people who are primarily taking care of the patients who get hospitalized. And from the perspective of livelihood development, you probably heard about our Honorable Minister of Finance announcing several financial measures, financial support measures, uh, which includes not only waiving off certain uh, loans on small and medium enterprises, but also have explained about non-penalty on repayment of EMIs and other loans that has been taken by households and others. So as you could see, that public health activities comprises of wide gamut of activities, and several of the activities and responsibilities in public health are spread across different sectors. So it is really an interesting field of work beyond what we understand and we learned during our undergraduate and postgraduate classes. For example, I was trained as a physician, and in my early career, I actually looked after patients. But later, I realized that I need to develop a more broader understanding about health sector. So I did a training in epidemiology and public health, and started working with the WHO and medical college, where we were involved in implementing large-scale population programs to provide maternal and child health care and vaccine support to the rural India. But then I also realized that it is interesting to understand how money flows and how we make decisions about which program to be implemented first, or where money should be spent, whether the money should be spent on introducing new vaccines, or whether money should be spent on setting up new medical colleges and cardiac rehabilitation units, or whether the money should be spent on setting up trauma centers across the country. So that with that understanding, I shifted from epidemiology to health economics. So in a sense, within the public health, you have a lot of opportunities and avenues to move from one place to another. So as I said, public health is a wise investment, and the interventions that we develop and deploy helps save money and also help save lives. So then what is research, and how does this research links to the public health? And as you probably have known, we probably have done a lot of simple research in biology and zoology. If you remember your school days in the biology classes, where we do dissection of mice and dissection of frog to understand how their body works. So at the public health level and the population level, we do similar kind of research, except that now our investigation of interest is generally the population, and we want to understand why a certain population has high prevalence of, say, infectious diseases. Or for example, from COVID, we would want to understand why the spread of COVID is so high in urban slums, and why the spread of COVID is so low in rich communities. So from the research perspective, we try to answer the questions that come to our mind. So it's kind of a systematic investigation in an area of your interest, and you want to answer those questions by generating new evidence, which are facts. And these facts then help you to create certain policies or to develop certain interventions, which will actually try to change the status quo. So for example, if you think from the COVID example again, you probably would be interested in understanding why the disease is spreading so fast in the major metropolitan areas, major metros like Delhi or Mumbai or Pune or Hyderabad or Bangalore, and why it is not spreading in small towns. So you would want to do an investigation, and you would understand that because it is a disease which spreads from person to person, wherever there is high population density, it's natural that the disease will spread faster in those communities. So you come to a conclusion that, okay, then if you want to stop the spread of this disease, then you have to put in certain restrictions for the population movement, or you have to put in certain restrictions so that the crowding does not take place, so people don't come in contact with each other, so the disease don't spread. So that's how you move from your research to an intervention which is helpful in preventing the spread of a disease. But research is a complex process. And why I say so? Because you need resources to do research. You need skilled manpower to do research. And you also have to understand who will benefit from this research, and whether the research in which I am interested, are there any other takers for that research? And then people might question your research findings. So your research has to be trustworthy. And then if all goes well, you have got, I mean, if you are, there are several other communities, several other people, including the government, who is interested in research, and you have done a very good research, a robust research, then the question arises, are there people who are willing to accept your research? Is there an intervention that is available and there is acceptability for that intervention? For example, let's take an example of the COVID vaccine. So we recognize that there is a new virus. We recognize that it is spreading very fast in our country as well across the globe. And several researchers recognize that a vaccine could be helpful in these situations. So they developed a vaccine. And then there was a clinical trial on the vaccine, and the vaccine was made available by the government for the people. But the important test of this vaccine is, interestingly, the acceptability of this vaccine by the people. Are people taking these vaccines? What is the price of the vaccine? Is it available free of cost, or you have to pay from your pocket? Whether the vaccine is available or accessible in your community or in your city or not. So those criteria also needs to be fulfilled for research to to start from a research question all the way to the development of intervention, which will help benefit the humanity. So with that background, we know we are from different walks of life, and several of our colleagues and our school friends, some people move forward to do engineering, some people move on to do social science such as economics and history, other people move on to do medical research, some people work in zoology, botany, and other geographical sciences. So there are different types of health research, if I may say so. It is basic research which helps develop a new product. For example, within the health system perspective, you can think of new products as a medicine, as a vaccine, as a diagnostic test. Then there is a clinical research. When I mean clinical research, we mean that now you want to test that vaccine, whether it is efficacious or not, on human population. You want to test that medicine on humans, whether it reduces blood pressure or not, whether it cures malaria or not, whether it cures your diabetes or not. So you do that research on human populations, that is clinical research. And then once that vaccine is available and it is proven beyond doubt to be a very efficacious vaccine, then you have to implement that vaccine across the country, across the globe. And that research is public health research. So people who join biological sciences, some move on to become scientists, some move on to become doctors, and some people take a path to move on to work in public health. And if you see it from a broader perspective, you would recognize that we are all doing the same thing. Some of our colleagues are developing new interventions, others are testing those new interventions, and those of us who are working in public health are actually helping implement those interventions at the population level to help uh, society. And these, if you now see it from the COVID perspective, though I tried to give these examples during my talk also over the course of last 10, 15 minutes, but as you can see that we can think of basic scientists doing genome sequencing, which is then used to develop diagnostics and medicines. We can think of epidemiologists who work in outbreak investigations. We can think of our friends in biotechnology who develop diagnostics and vaccines. And we can think of our friends in social sciences, in psychology, in economics, who talk about public health messaging, who talks about resource allocation for vaccine implementation in the country. And you can also think about our friends who work in hospitals and other places who take care of patients. So from an ecological perspective, from a societal perspective, all of us, though are in different fields, actually work together for the betterment of the society. And that's the beauty of the research continuity. So we recognize that in our country, we need to strengthen our research capacity, and we also need to strengthen in our implementation capacity, because we know that from some health indicators perspective, though we are doing well and we have improved our performance in the past few decades, but still we need to catch up with other countries who are doing much better than us, and our neighbor China is certainly one of them. So from that perspective, we need to develop our research capacity as well as our health systems capacity as well as our implementation capacity. So as I mentioned previously also, that we have implemented several other programs to improve the indicators related to social sector, indicators related to education sector, and also indicators related to health. Our government has invested a humongous amount of resources, and we can see that also through development of several institutes of excellence, such as Indian Institute of Science Education Research, All Indian Institute of Medical Sciences, institutes of technology and others, which are catering to this demand for trained manpower and trained human resources. So the conclusion that I'm trying to make is that at this point of our economic progress and our development, we are in need of uh, talented and trained human resources to take the country forward. And in terms of simple numbers, this requirement is in tune of hundreds of thousands of trained manpower. From the public health community perspective, from the public health perspective, now I'm going to give you a brief idea on what are different education avenues in the public health. And though you know that within each specialty, each discipline that we are trained in, whether it is biology or zoology or MBBS, or for that matter, BSc biotechnology or others, uh, we can always do a post-graduation in the same discipline and move forward to do a PhD to join an academic career. But we can also think of doing masters in public health and masters in other areas of public health, such as clinical research or bioinformatics, and go on to work in public health related departments in the government and work in public health implementation. So with that background, I would like to invite
So you are not audible, sir.
is it better now?
Yes, sir. Yes.
So I was saying that from the demand perspective, we are in need of hundreds of thousands of trained manpower, and not only in the basic clinical sciences, but also in clinical research as well as in public health. And here at Public Health Foundation of India, we offer masters in public health, which is offered through Academy of Scientific and Industrial Research, which is the Institute of National Importance by Government of India. And we offer courses in clinical research and postgraduate diploma in public health management, which is offered in collaboration with the Ministry of Health and Family Welfare, which is supported by the National Health Mission. And we offer courses which are integrated MSc PhD courses in the clinical research. And the idea is to cater to the need of these professionals that are required in the country to work in public health, to work in clinical research, and to work in health management. And as I just said, that Academy of Scientific and Industrial Research is the top academy of Government of India, and it's an institute of national importance, through which we offer our programs. And some of the unique features of our programs include competency-driven frameworks and the faculty which has been trained all over the world. And a lot of these programs are actually has a very good interface with the prospective employers, and we offer hands-on training in each of these programs. And so the students who come to join these programs are from diverse backgrounds. So in our class of MPH, we have people from veterinary sciences, nursing sciences, doctors, economists, and other areas sitting together and learning from each other. And in terms of opportunities that are available in research and in public health, we know that India has one of the biggest pharmaceutical industry in the world. And there are huge tons of opportunities for people doing clinical research for their jobs in the clinical research industry, clinical trial industry, and more generally in the pharmaceutical industry itself. And in the public health, we know that there are several organizations, not only just the national government, which has launched several programs such as the National Health Mission and Ayushman Bharat, but also various other international agencies such as World Health Organization, UNDP, UNICEF, who also require people trained in the public health. So there are several opportunities for the budding researchers and public health professionals in the area of public health. That's what I would conclude. And this is probably my last slide, where we just highlight several of our employers of our graduates who have passed from PHFI. But in the end, I would just conclude by saying that, as I mentioned in my talk, that all of us, whether we are in different areas of specialization or we work in different specialities, from the continuum of the scientific research perspective or from the continuum of the science itself, we all work together. Some of us work in product development, some of us work in product testing, and some of us work in implementing those research fruits to the betterment of the society. And I would stop by saying that COVID vaccine is one of those important examples where within a year of time, we have been able to develop a vaccine for a novel pathogen, and we are able to implement and provide that vaccine to the millions of citizens of our country in such a small period of time. And I would tout that example as a miracle, because it has never happened in the world in the last few hundred years that we have been able to develop a vaccine for a novel pathogen in less than a year's time and are able to implement that vaccine at the country level for the benefit of the country, for the benefit of the society. And I'll stop here. If you have any questions, please feel free to ask or type in the chat box. Thank you very much. And this slide provides our web address for application if any of you are interested in pursuing the career in clinical research or masters in public health. Thank you very much. Over to Dr. Ankita.
Thank you, sir. This is Dr. Shweta. Thank you very much for sharing your insights about public health and its avenues. Now we'll be taking questions for sir. The participants are requested to post their questions in the chat box. Sir, we have a question from Gitanshi. Yeah. She says, I'm a botany student, and if I go for this course, so how is it different from other research courses? And you just mentioned the example of COVID, and person from other background like biotechnology also work on it. So how this course make the clinical research different from them? Okay, so she is from botany, I heard? Yes, sir. She is a botany student. Yeah. So the courses in the clinical research and the public health, whether it's a master's in clinical research or a master's in public health, they provide a platform, a fundamental platform, and bring in different specialities together. So for example, if somebody joins masters in public health, they would be provided basic training in epidemiology. I mean, starting from public health itself, in epidemiology, in biostatistics, in communicable and the non-communicable diseases, and then in health policy, planning, financing, and other areas of research. Whereas in the clinical research, the pathway is more or less similar, but after doing a formal training in public health and then moving on to biostatistics and epidemiology, then we move towards product development. For example, drug development, different types of animal studies and human studies, from drug development to clinical trials. How do industry conduct different clinical trials, and from clinical trials to innovation, from innovation to economic evaluation of those products, and then from economic evaluation to implementation of those products. So in a sense, once you have a fundamental understanding in basic sciences such as biology or zoology or even botany, you are, I would say, appropriately trained to actually move to a broader understanding of clinical research or drug development or public health. I hope that answers the question. Thank you, sir. I hope Gitanshi, she says thank you. So other participants, if you have any queries, you can post in the chat box. Okay, so Sharanya, Ms. Sharanya Sheikh. Sir, do students from a physics course also have scope to go into this field?
That's a very interesting question, and I can tell you one thing, that we do need people from physics and mathematics also. So, for example, uh, we do what is called as econometric modeling and infectious disease modeling, where we require people to be formally trained in algebra, calculus, and other areas. So people who are trained in physics are very much welcome in this field of work, because they are the ones who are appropriately trained to run and actually do computer programming and develop large scale data set based models on disease transmission and econometric modeling with regards to financial resource allocation. So yeah, very much, yeah. People from physics background are also very useful in area of public health.
Thank you, sir. So I hope that answers your question, Sharanya. Other participants, please post your queries for sir. So one thing I wanted to ask was, are there any steps that we can take? I'm sure there would be for public health sector, so that society would be maybe less vulnerable or more prepared for such future pandemics. I mean, taking lessons from this.
Absolutely, absolutely. It's a very good question. Actually, we have a full, I would say, a work area and a set of individuals who work in this area. They are called as people who work in pandemic preparedness. So, for example, I mentioned about SARS-CoV-2, and you probably have wondered why it is called as COVID-2, which means there was a COVID-1. And the COVID-1 actually spread in China and some parts of East Asia and Hong Kong and other places of the world in 2003. And you probably have recognized that those countries haven't had witnessed such a large scale devastation as other countries in the world has witnessed. And the reason was because they were exposed, so they actually invested their resource in prevention and preparedness. And unfortunately, other countries didn't. So that's why we actually had a difficult time over the last 1.5 years. So there's certainly there are people who work in pandemic preparedness, and the countries invest their resources in those areas. And the ones who actually had an earlier outbreak I mean, we're lucky this time.
Yeah, thank you, sir. Sir, we have a question from Benita. She asks, do students from humanities are eligible for this course?
When you say humanities, you mean history and arts and other areas?
Yeah, Benita, you can specify exactly which area are you trying to point out? Which area from humanity?
Generally, I would say that, I mean, people from, I mean, any graduate is eligible. But what usually happens is, because we know that some of our programs, such as programs which are primarily science-based, so the regulatory agencies, which is like ACSIR in this case, expects that students are formally trained during their higher secondary training in the specific areas. So in general, in public health, everyone is eligible, but specific science-based programs, such as integrated MSc to PhD, I think the regulatory agencies require a formal training during the higher secondary and high school, I think. But we can check with that from the brochure of the specific program. So for example, if our colleague is interested in MSc-CR, I'll request Anuja to send across MSc-CR brochure as well as MSc Public Health brochure.
Sure, sir.
Thank you, sir. That would be a great help for all the interested students.
Sure, I mean, eligibility criteria are quite clearly mentioned in those brochures.
So the students can very well go through the criteria and apply accordingly.
Sure.
Yes. Thank you so much, sir. Any more questions, participants? Please post your questions for sir. So one area that I once again was curious was the area of health policies, implementation of the policies related to public health. Do we need to have a stricter implementation, or do we need to like modify the policies to be better prepared for such situations?
Well, I mean, again, it's a difficult question. As you would understand that a large part of what happens at the implementation level is driven by human behavior. So, I mean, we also are a democratic country, so we cannot actually infringe upon the individual rights. And interestingly, I think you have asked a very good question. There has to be a balance that we needs to maintain with regards to uh, the policies which are actually determining, for example, the spread of a disease such as COVID. So, for example, you could have lockdowns, you could have very hard lockdowns, but they actually impinge upon individual freedom of livelihood. And I mean, there are people who actually on their daily wages by selling fruits and other things. And if you put lockdowns, then they are really hurt very much. I mean, economic impact is devastating. Whereas on the other side, you can think of having a better communication in terms of risk assessment and risk management, using vernacular language, using the language that majority of our population speak, depending upon different parts of the country, and can explain to them the risks involved with their behavior. So probably then you don't need to actually get into hard lockdowns, and you can manage diseases by having some broad-based and population-supported policies.
Indeed, sir. Thank you, sir. So participants, if you have any more questions for sir, you can post. I suppose they have answered the questions very, very patiently and nicely, sir. So if there are no more questions, I would once again thank you, sir, for a very interesting talk. It was really a privilege to hear you. And I'm sure the course and the area that you explained, the new avenue, it would be very, very helpful for all the interested students. So once again, thank you, sir, for such an interesting talk. Now I request my colleague, Dr. Ankita, to propose a vote of thanks.
Thank you very much. It was indeed a pleasure and a privilege to be with you and your students and others who are hearing this talk. Thank you very much.
Thank you, sir.
Thank you, Dr. Shweta. We are extremely grateful to our esteemed speaker, Dr. Farooqi, who patiently took all the questions and enlightened the students. We would also like to thank the participants who were a part of today's event. We hope that you will join us again tomorrow for Ms. Shiva Kapoor and Ms. Bhavna Prajapati's illuminating sessions. Ms. Kapoor will speak on holistic wellness through Ayurveda, and Ms. Prajapati will address the theme of women's health and education and nutrition. Now I request all the participants to switch on their camera for the ceremonial group photograph. You can switch on your camera so that we can take a photograph.
With Postgres, they are believing that they will get stuck in this project for long. So the understanding, I'll exactly tell you what methods I think.
Somebody's phone.
What I have.
It's not
taking the time.
Yourself.
Myself, and we have done this analysis of looking at whether we can move to Postgres. I was telling you earlier. So Nathan was also involved. He was like, you remember?
Now you stop the cameras. Now we formally end today's session. Before leaving, please enjoy a presentation of beautiful paintings of one of our alumni, Dr. Pooja Gopal, and then you are free to log out the meeting. Thank you everyone for joining today. Hope to see you tomorrow. Thank you so much.